detect. But the ones who are carriers and are not sick, that's where the real danger lies. Because it is possible for two people who are carriers but are not sick to come together, get children, and get children who are either carriers or are actually sick with sickle cell. That's why our call to action today, one of our calls to action is please get tested, especially the young people who intend to have children. Once they have identified, first of all, know your own sickle cell status, and then when you get a partner who you intend to have children with, know his or her status as well, so that you make an informed decision. We avoid instances of carriers transmitting the disease without knowing they're doing it, and then, like Grace says, it becomes a blame game. The ideal situation would be everybody amongst us knows their sickle cell status. Then as people make decisions about marrying, about siring children and so on, everybody knows that this is my status and this is the status of the partner that I want to have children with. The other call to action is the preachers, and I've talked about that again and again. We have engaged the preachers, those who normally do premarital counseling, those who counsel young people. As they encourage people to go for HIV testing, also encourage them to go for sickle cell testing. There are quite a number of things that need to happen. One, people need to be aware that this is a problem. Number two, people need to seek to get tested. Now, as a county, we have realized that people had to go very far to get sickle cell testing, which for us was a problem. So we have decided to bring a machine closer to you. There is now a machine which Grace referred to, HB electrophoresis machine. It's now in Busia Referral Hospital, where you can go in, you can get tested, you can know your status, you can know the status of your partner if you decide to do that.
Basically, our screening in our facilities, we realize that most of the patients that are taken, looking at our trend, taken for sickle cell screening, around 25% of those patients will always turn out to be positive for Sickle test. It's been a while now, but we are lucky. We are blessed. We now have the HP electrophoresis machine in the county. We have now a confirmatory test. We are yet to, which was installed just recently. So with that one, we'll be able to get the exact numbers of patients in Busia County who are now suffering from sickle cell, and going forward, we can easily ascertain what is our real burden. But in the country, we're saying annually more than 14,000 children are born with sickle cell every year in this country, and we are talking about the high, especially the high burden counties. Where Busia, we have 17 high burden counties, and Busia is one of them. And when you look at that statistics, if you're having 14,000 children being born with sickle cell every year, that calls for action. The reason why we are here. The misconception that we have in the community is that maybe it's coming from one side of the family, and that is breaking a lot of marriages. We see people saying that this one is not in our generation, in our family. Maybe it is in your family. But when now we have the HB electrophoresis in the county, I'd urge people, instead of breaking your marriage, come to the hospital, let us test which genotype are you, so that we can be able to say, why is it that you're having a child who has sickle cell disease? And the best thing that you can do, the signs and symptoms for a child who has sickle cell, they start appearing when the child is also pretty young, but a little bit around 9 months there, when the call it fetal hemoglobin has started going down. You start seeing signs and symptoms. You need to come to the hospital very fast to be able to be screened or to be tested, so that if we start treatment early, we have hydroxyurea, a very good drug. We call it a one.
In Kenya, we have 21 counties where we call high burden areas, but because of what the DG has explained, because it's spread through genetics and through marriage, and now we have so many intermarriages happening, so it can also be anywhere. So what we're encouraging through this awareness, just as we have emphasized, is infant screening. One thing that the Ministry of Health insists on, the guidelines that we have worked together to develop, is also to make sure that as a child is born, it's good we also know their status. So as we are here today, part of the awareness is to encourage couples, encourage young people just to know their status, and then now from there we see how do we manage the care of the deceased. For the first time, that sickle cell disease was also incorporated in SHA. And now if you have SHA as a sickler, as an outpatient, you get 6,000 treatment. It's not enough, but it's a step towards the right direction. Advocates, whoever is hearing, please, in the next round, consider more. As Grace has mentioned, hydroxyurea is a very expensive drug. And it's something they have to take for the rest of their life, together with folic acid, together with the Poldrin. So a normal, regular family in Busia, that medication is out of reach. And immediately you stop taking that drug. That's when now the crisis comes in. Many things develop, the complications we call about the sickle cell, the sickling of the cell. Blood is another challenge. And that's why we're also saying, young people, if you can donate. Many a times a parent will go, the blood level is very low, there's no blood in the facility. We need to see how we can also continue doing the blood drive so that when a warrior, because once the blood is sickled, the circulation is not even there, therefore they need to be transfused to be able to be normal again.